dear viewers, the importance of hand washing and how this actually acts in a big way in terms of reducing the spread of disease and protecting health. And this is something which has now become a new normal. On the show this evening, we have a high-powered panel from WHO and UNICEF and also Government of India, not only to talk about the initiatives that are in place put together, government in tandem with these multilateral agencies, but what is the way forward, and especially the role that India plays even when we talk about the significance of initiatives like Global Hand Washing Day during the pandemic time. And to do so, let me quickly introduce my panel. And this indeed happens to be a very special edition of DD Dialogue because it's a high-powered panel, representatives from WHO, UNICEF and Government of India. And I'm extremely honored to welcome my panelists from UNICEF, Nicola Osbert. He is Chief Water Sanitation Hygiene Wash, UNICEF India. Nicholas, thank you so much again for joining us on DD India, and very honored to have Ms. Payden with us on the show on this edition of DD Dialogue. She is WHO representative to India, Deputy WHO representative to India. She's going to be talking to us, and she of course has a very rich body of work behind her, and very happy and honored to also have on the show representing Government of India, Mr. Yugal Joshi. He represents Jal Shakti vertical of the government, and he is Jal Jeevan Mission Director. Thank you very much, Joshi, also for joining us on the show. I'm going to quickly start with Nicola, because Nicola is all smiles out there. Nicola, very quickly now, Global Hand Washing Day amidst COVID times. I have lots of numbers and figures with me, and they say that in the midst of the pandemic, 3 in 10 people worldwide did not have access to hand hygiene. If you have to quickly underscore the significance of what really makes this year's Global Hand Washing Day all the more significant, particularly the big takeaways from India model and the initiatives that have been specifically spearheaded by UNICEF.
All right, thank you. So what makes it a special Global Hand Washing Day event 2021 is, of course, the COVID-19 pandemic. Let's admit it, we have been, UNICEF, WHO, and many other development partners have been advocating and supporting the promotion of hand washing with soap, because we have the evidence and we know how impactful it is, how it allows to save lives, to reduce waterborne disease and prevent disease. And we have been really working hard on that. But the COVID-19 pandemic did in 2 years more than what we tried to do for 2 decades. Right, raising the profile of hand hygiene. Now the issue it's really promoting the habit of hand washing because of fear, because of a real example of the threats at stake. Whereas in behavior change approach, we also try to make things aspirational. So to speak, making something aspirational, people should be proud to have a hand washing station in their main living room, even in rural areas, in the place they live, in the place where they receive their guests, and be proud of that, a nice object. And that's an example of making it aspirational. So and so we are building on that mass awareness raising on hand washing practice. And it's doing, I mean, it's unfortunate to say so, but it's a silver lining of the crisis to have this awareness raising. But the point, and that's what we try to do to answer your question, we shouldn't stop there. It's not just about COVID-19.
Yes.
Continue. India is a very special country with regard to cleanliness, water and sanitation. Nowhere in the world we have such large-scale programs such as the Swachh Bharat Mission Phase 2 and above all the Jal Jeevan Mission. So in this context, there is a real drive for cleanliness, for changing the habits. And this is where we really want to ensure that hand washing with soap is really a government-owned program with targets, monitoring systems, accountabilities across the board in these 2 programs, but also in schools, health facilities, Anganwadi centers, because unless we also have hand washing practice there, we won't succeed.
Let me take the same question to Ms. Payden now. WHO interventions, observations, and the distance traveled so far, and how do you look at the very criticality of observing Global Hand Washing Day? And I'm sure you would agree, Ms. Payton, that this is not just something that we as a nation or as a global community, we have to just observe it on one single day, but its ramifications are wide and large.
Hand washing, as we have heard, it's important. We should be observing it every minute, not just dedicate one day through in the year for hand washing. But it's basically to provide key focus and priority on hand washing. That Global Hand Washing Day has been dedicated to that. So now in terms of the effects of hand washing, it's multiple benefits. It has benefits to reduce diarrheal diseases. It also benefits to reduce acute respiratory infections, including COVID-19. In addition, hand hygiene is also very important during labor, delivery, and postnatal care when babies are born, especially to prevent infections in newborns as well as mothers. So that's important. And then healthcare associated infections can be also prevented within the healthcare facility when healthcare workers are providing services to patients. So in terms of healthcare associated infections prevented in patients which are already admitted in the hospital. So there are multiple benefits from hand washing. And not only that, even during menstruation, especially for girls and women,
yes,
hand washing, hand hygiene is so important during menstruation. And then when women and grandmothers are caring for babies, hand washing is very important to reduce infection in babies as well. So from that perspective, it was always important, but the COVID pandemic brought limelight to hand washing as it is one of the most cost-effective interventions to prevent COVID-19 as well. So in terms of WHO, we are working with UNICEF and all the partners and the Ministry of Health and Family Welfare as well as Ministry of Jal Shakti to basically re-emphasize the importance of hand washing, advocacy, promotion, as well as capacity building among the healthcare workers and other allied workers to focus on hand hygiene, to come up with innovations in terms of providing access, easy access to hand washing facilities in all settings, be it community, be it in urban towns,
right,
be it in the healthcare facilities or in schools, public places, etc. So basically, we are working together to come up with a huge campaign and to spread the awareness on hand washing and the need to provide easily accessible facilities where it is needed most.
Okay, where it is needed the most. And since you talked about Jal Shakti is one of the verticals of the government of India, which you are working very closely with, and we have Mr. Joshi here, Mission Director. Now, hand washing means water connections. Water connections means tap water, and rural India. In fact, your vertical has done a lot of work in that space, Mr. Joshi, tap water connections to rural schools and Anganwadi. Now, achieving hand washing, optimizing this at micro level cannot be possible without ensuring water connections to the far-flung areas.
It's very true. The experts from UNICEF and WHO here, they outlined, how critical is hand washing for prevention of life-threatening diseases. And Nicola also talked about, how important is behavior change. And short-term behavior change, because of the fear of the disease, it won't last long until and unless, like in Swachh Bharat, we saw, long-lasting behavioral change, how through a Jan Andolan these can be done. But the most important part, as you rightly expressed, is whether we are providing tap water connection to far-flung areas, and more so, importantly, to schools and Anganwadi centers and others. Like in Jal Jeevan Mission, the important part is how, with the involvement, engagement of communities, Jal Jeevan Mission is with the cooperation, with the very close coordination with the states, we are trying to take tap water to each and every rural home. And in last 25 months or so, more than 5.12 crore tap water connections have been provided to rural India. And as you know, 6 states and union territories have become Har Ghar Jal, means each and every household there is now having tap water connection.
Tap water connection.
But the most important thing I would like to highlight here is that last year on 2nd of October, inspired by the Prime Minister, Honorable Minister of Jal Shakti, he launched a campaign that why cannot each and every school and Anganwadi center in our country can have tap water connections. So at the time, it was thought, tap water connection does not mean only for the drinking water. It should be for hand washing facilities as well. It should be for using in toilets and also cooking for midday meal.
Correct.
And everybody should be very happy and proud to have these achievements. Like say, when this campaign was launched last year, at the time only 4.4 lakh schools were having tap water connections. But now, as of now, 8.054 lakh schools are having tap water connections. Not only that, in 6.71 lakh of those are also having multiple connections, like in toilets, in 7.98 for hand washing facilities, and
so a lot of distance has been covered.
And 13 states have now all their schools and Anganwadi centers, they have tap water connections. So once we recently I visited a very remote place in Uttarakhand where children are obviously initially a bit skeptical how to go to school, but now they know there is water for drinking, there is water for hand washing. Even parents are very happy to see.
So you're saying that access and infrastructure is not a problem, but there is a long way to go. Access and infrastructure.
No, in fact, we are very much committed that at least in all schools and Anganwadis, this water to every school and Anganwadis will reach very soon. And as Jal Jeevan Mission's target is 2024, by 2024, all the households in rural India will have access to tap water connections. They will be having tap water connections.
Okay. Nicola, quickly just to add to that, the point on access and infrastructure, and does India really have an enabling environment, COVID or no COVID? UNICEF has done a lot of work here, but yes, pandemic has given the UNICEF, WHO and other agencies a new vertical to work on that. Would you say that now we have to move a little more faster, at least 4 times faster or 5 times faster in terms of assuring that these not only the sanitation but water needs or necessities should be met? India model, India perspective.
All right. So first of all, the programs mentioned by Mr. Yugal Joshi, this 100 days campaign for child-centric organizations such as mine, UNICEF, is a blessing. Really, and what we really appreciate here, it's not a ticking the box exercise. There is a real drive, and we have been to the field together to ensure it's not just connection to tap water. It's used, it's about cleanliness, it's integrated with the Swachh Bharat, and that's really the drive from the ministry, and really hope it will stay this way. Now, what needs to be done? So if we look at some statistics also coming from the ministry, the NAR survey recent show that 95% of schools have a hand washing space, but only 40% have water and soap. If you look in Anganwadi centers, it's the same issue. So what does it tell? Infrastructure is not the only thing to translate into practice. And India, I mean, there is a very strong expertise in the government, among NGOs, among partners on those behavior change issues, because now India has been engaging in this water and sanitation drive for quite some time now with the Swachh Bharat mission. So all this science of behavior change must be put into practice, because this the Jal Jeevan mission and the 100 Days campaign provide the infrastructure and promotes the behavior change and the local governance for operation and maintenance. This is really important.
That comes to 2 important questions for Ms. Peri. Not really questions, but just a thought, since Nicola talked about the target. So we have sustainable development goals, also talking about 2030 target line being striving towards universal hand hygiene. Part A. Part B, do you think India needs more resilient systems to sustain these effective hand washing practices? It's not about only implementing or introducing these systems, but also sustaining them, considering we are such a diverse nation, cultures, topography, etc.
Thank you. So as we have heard from Dr. Joshi and Nicholas, India has come up with this huge mission, Jal Jeevan mission, to provide piped water supply to every household in all the rural areas by 2024, which is much ahead of the 2030 SDG goal of providing universal access of water supply to every person in the world. So India is much ahead of that. And as we have seen, compared to 2019 when Jal Jeevan Mission started, now as of today, about 43.44% of rural households have tap water, as compared to 16.83% on August 15 in 2019. So India has made huge progress in terms of providing water, drinking water inside the house in the rural areas. However, as you have said, sustaining the gains is key. Just having pipe network is not enough. There has to be water flowing in the pipe. And for that, it's not just the government's responsibility. The people who are benefiting from these pipe networks have to have equal responsibility in taking care of the water supply that is provided to them free of cost by the government. So it's both sides. Everybody has their responsibility to ensure that these piped water supply systems are functioning. And when these are functioning, then you have good facility to practice hygiene, other hygiene aspects, as well as hand hygiene. So sustaining that is important. And even taking cue from Swachh Bharat, where the government first started with providing sanitation facility to every household. Now, providing facility is not enough. People have to use it. Unless you use it, you won't have the desired health benefits or outcomes.
So, Mr. Joshi, so the buck stops with Jal Jeevan Mission, and obviously, but you all are working together in this in tandem with each other.
Oh, both Ms. Payden and Nicola both made very valid points. Only infrastructure creation will not do. We have to do behavior change. We have to make people use, like in case of toilets.
It sounds like a perfect community engagement model that other countries can really take cue from. I could see Nicola also nodding out there. But Nicola, over to you. What do you want to add to that? But at the same time, the challenges or the bottlenecks or the roadblocks that UNICEF sees clearly, and that is something which India would want to work on immediately.
First, I would like to acknowledge the consistency of the Ministry of Jal Shakti in this program. Again, it's not just words. Funding is there, capacity development is there, and making that Jan Andolan work in the various contexts of India is not an easy thing. And so they have engaged care resource centers, train them to enable to change the mindset for the functionaries to really target for a service that lasts. And then they're engaging also civil society organizations at the grassroots level, at the GP level, to be that interface between the GP administration and the communities. They've trained volunteers for the behavior change, and this is much appreciated. On the data side as well, you should visit the Jal Jeevan dashboard. There is a lot of live things. The good, the bad, or the ugly, it's online and you can access it. And this effort of transparency is much appreciated. So in terms of challenges, because there are many, first, perhaps that dashboard and the one from the Swachh Bharat mission could include some indicators monitoring indicators on hand washing practice.
Okay.
At least, yes, that is one. And the other thing that we need to look ahead, what's coming next in India. And unfortunately, beyond the COVID-19 crisis, what's coming next in India, it's the impact of climate changes.
Okay.
That is a big one, whereby the people there are affected by droughts, and then we have cities that are really affected by floods now. Like it's very clear there is evidence here. How do we prepare the Indian communities for that? How do we prepare the powerful Indian administration to address? So emergency response in India is among the best. We have seen incredible things when it comes to cyclones and flash floods. But then building that resilience starting now, like 5 years ahead of the curve, so that we are ready. And so the programs such as the Swachh Bharat mission and the Jal Jeevan mission allows for that. But we really need to go to the detail. What is it to have water resource planning at the community level and being owned? What does it mean to have...
So you mean more micro-management, micro-level management?
Governance. Perhaps we have to look in the area of social policies, like we have Manrega and others, but schemes for people affected by climate changes. All the surveillance of on-the-ground water is one, and the capacity at the grassroots level to organize and anticipate crises, not just respond to them. And that's a big ticket item. It will affect water supply, hand washing is all of that. And unfortunately, India, there are a lot of studies, but it's perhaps the 7th most vulnerable country to climate changes. There is a lot of work going on. Those big flagships that. But let's think further on what else can be done at the community level.
Okay, Ms. Payden, now final remarks from you and from other two panelists as well, because we're really running short of time. And anything that you would want to add, your message, not only to the world community, but to India in particular. WHO has done incredible amount of work in all spheres, but especially in this space.
Thank you. So, my final remarks, hand washing is key for preventing so many diseases, and we must make it a reality for everyone in India to have access to hand washing facilities wherever they are and at any time that they require. That will be one of the priority activities. And India has shown many examples of going to scale. For example, polio elimination, India has shown the way of how they can expand interventions nationwide. It's a country which is almost like 35 countries put together. It's a huge, diverse country, but India has shown many times that it can put up many programs at scale. And I'm sure with Jal Jeevan Mission and the Swachh Bharat Mission, with huge ambitious goals and with all the resources allocated to these programs, I'm sure India will be able to provide water sanitation and hand hygiene facilities to every citizen in this country. So it's a very positive message that I'm trying to give, and also countries can really learn from India. There are many things that other countries can learn from India.
All right, very, very assuring. Mr. Joshi?
Yeah, in fact, what Nicola talked about climate change, that's a reality, and government is doing a lot for that. For example, government launched Jal Shakti Abhiyan a couple of years ago, and this year also again the Catch the Rain, and we started it in big way to how to conserve the water, how rainwater harvesting can be done, and we have at more than 13,000 implementation support agencies on the ground who teach people about these all things, and who help. Like Nicola talked about the KRCs, we have more than 104 KRCs empaneled who teach people about how source strengthening, source augmentation, climate change will be affecting these water sources and other things that we can only save through water conservation, through rainwater harvesting, through proper management of our used water. So these all things Jal Jeevan Mission is doing, along with providing tap water connections to each and every household. Key important thing is that IEC and the behavior change communication is very important, so that each and every person in the village understand the value of each drop of water. Yeah, thank you.
Okay, Nicola.
A lot was said already. Again, it's everyone's hand washing with soap. The government is doing their share, but it's everyone's business. It's the journalists, yourself including, and the media, social media, and each and every individual. Children as well, they can promote that. If they hear us today, go and talk to your families, go out and mobilize young people as well, so that it becomes like a habit and something that is collective. And not just it's the role of the government. The government is doing their part. We must do, and all the movie stars and all the powerful communication capacity of India. And the last but not least, also the private sector, as those programs bring livelihood opportunity. There were estimates the sanitation market alone in India is worth $30 to $60 billion. So what the transformation that's brought by the JJM involving those ISS, CSOs at the grassroots level and professionals, we can really have market-driven solution. If there is demand for a nice hand washing station, a cheap one, affordable, then the market, India has a very dynamic entrepreneurship and private sector. Let's use them as well. They will fill the gap, and they will support, and that is unique to India. And so that's it. Everybody should know when to wash hands and promote it, and then everybody will have a better life in India. And as Payden mentioned, India is a global influencer in water and sanitation. We use India abroad. We use India in Nigeria, in Ethiopia, in many other countries because of that drive. So as much as there are challenges and a lot of things to finish in the country, the drive is aspiring others to follow, and that's part of the job of WHO.
Well, I have two headlines here coming from UNICEF and WHO. WHO says that world has lots of lessons to learn from India, and UNICEF contends that India is seen as a global influencer when it comes to initiatives like hand washing, etc. Well, that sounds very, very reassuring. And Mission Director Jal Shakti, would you like to quickly add some 30 seconds, 10 seconds to that? I think your job is cut out for you, sir. Lot of expectations. The world is looking at us.
Sure, we all are working together, center, state, Jal Jeevan Mission, National Jal Jeevan Mission at center, state Jal Jeevan Missions, village people most importantly, and people like our development partners, UNICEF, WHO, everybody is together. We are doing it all together, and we will be very soon successful in our mission.
Yes, thank you very much all of you. Peyton, thank you so much. Namaste.